Hello, my name is Amy Sturkey. I am a pediatric physical therapist. I'm here with Erica and her son Ilya. And Ilya is 5 months old. He was 1 month premature. And he is having difficulty with feeding.
Yes.
And he's got a tethered upper lip and a tethered tongue. And on this video, we're going to talk about the red flags for tethered tissue. There are feeding challenges that go along with having a tongue tie or a tethered upper lip. They include things like being a sleepy feeder or a cluster feeder or a fussy feeder. They can also be a picky eater. They can, since they're having such trouble sucking at the breast, it can cause painful breastfeeding. It can cause difficulty with clogged ducts and mastitis. What you often see is that they will gag or they will choke as they try to feed. They later on can have difficulty transitioning from the bottle to the breast, or from transitioning to solid food, or later having trouble going from drinking from a cup to drinking with a straw. They might have trouble with keeping the food too much in the center of their mouth or in the front of their mouth, or pocketing off to the side of their mouth, or overstuffing their mouth. I'm wondering if Ilya has any of these troubles that we've talked about.
So he does. So oftentimes when he is eating, we do see that he will have excess food left over in the back, so almost like in his cheeks. Almost to the side, even after he's done eating. It could be even as late as 5 minutes after he's done eating. And so he has like a trickle effect almost, where it's continuing to go down. A lot of times we do see that Ilya does have coughing and gagging fits while he is eating because of his lip and tongue tie. For me personally, we're no longer able to breastfeed due to his poor suction and his poor latch. I don't experience personally, and this is kind of what one of those coughing fits starts like. I personally don't have any issue with, mastitis, clogged ducts, any of that, because I pump. So that's the good thing about where I work. I get enough breaks to do that. So I do pump so that I don't have any kind of pain as far as breastfeeding goes. And for Ilya himself, he is a bit of a fussy eater. He does get to the point where he feels overwhelmed, and oftentimes we'll see him push away. So he does take his hand and he'll let us know, I don't want it anymore. Wow. I feel uncomfortable. And he'll push like the bottleneck away from us. So we do see that with him when he's eating.
In terms of other issues, there are gastrointestinal challenges that you see with these children. They have trouble with GERD or gas. They have trouble with constipation, reflux, or poor weight gain.
Yeah. So
tell me, does he have any of these issues?
He does. So he does have GERD, and he does also have poor weight gain. That's due to the coughing, gagging, vomiting. So he does have that, and he did struggle a lot with gas earlier on during bottle feeding. Before we were able to, find the proper bottle for him and find a way while we're feeding him that helps accommodate his lip and tongue tie, as well as the coughing and the gagging. So he doesn't struggle with gas as much anymore, but GERD and the poor weight gain are definitely still huge factors.
Does he have any trouble with constipation?
Actually, not at all. So he does have regular bowel movements. And I don't know if that's just because of the changes that we've made, or I don't know if it's because as far as his lower intestine and everything happening, lower down, I don't know if it's just because that is perfect and unaffected, and it's just that he has some underlying issues with further up that cause these issues. And so we've got some studies we're going through to try to rule those out.
Another red flag for having tethered oral tissues is having trouble with sleep. So these children can be mouth breathers, they can have sleep apnea, they can snore, they can be heavy breathers, they can have swollen adenoids or tonsils. Does Ilya have any of these issues?
So he does not have, that we know of, any kind of like sleep apnea, swollen adenoids, anything like that. We do hear, he is a very heavy breather though, and a lot of times you can hear that. It's almost, in some cases, even a raspy sound.
Is he a little restless then?
He does sleep. When he sleeps well. But the stretches that he sleeps are short. He may sleep a couple of hours, but I also do still awake every 3 hours through the night to feed him due to the poor weight gain. Yeah, right. So he's got a round-the-clock schedule. It's like clockwork, 2:30, 5:30, 8:30, 11:30, 2:30, 5:30, 8:30, 11:30. And so that's ingrained in us.
You're back to work, so wow.
Yeah. So even though I'm back to work, I still wake up at 2:30 in the morning, and I still go to work, and I work my 8.5 hours, and I keep up that schedule. So gotta do what you gotta do.
That's right. Okay, in terms of other red flags for having tethered oral tissues, there are more developmental concerns. You see often these kids who have the tethered oral tissues also have a torticollis, or difficulties with their head shape. They have a poor tolerance to tummy time. They may have ADHD and other sensory processing difficulties. Does Ilya have any of those troubles?
So he does. So he does have torticollis. We are actively working on that. You have definitely given us lots of help, lots of pointers that have helped us a lot. He sees an OT that helps as well. He did have that flat portion on his head.
It's so much better.
And it is a lot better. So there are lots of people who have seen it, and later on down the road have now seen him, and they've said, "Oh my goodness, I can't believe the improvement he's made." So that's gotten a lot better.
What about tummy time?
Tummy time, that is a difficult subject for him. He does not like it. He is very uncomfortable. We do have to use that elevated, or that what's
inclined?
Yeah, the inclined tummy time. We also have a boppy that we use too, because he can't just do the lay flat tummy time like most kids can do. And as far as anything else, he otherwise does pretty well. It's really just that torticollis that we're having to work with, which has improved. So he can look to the left now. So we're pretty excited about that.
So another red flag for tethered oral tissue is being born in a breech presentation, or having hiccups before born in utero, and also poor mobility. Did he have any of those problems?
So it's really funny. He did not. So he was born head down. I think they referred to the way that he was born as being sunny side up. But still head down. So he still was an active in utero baby. He did have hiccups, but his birth was a pretty smooth, uneventful birth, as in terms of me, having him. It was the problems we had afterward that made it difficult. So, in utero, a perfect guy, nothing to complain about.
I hope this is a good summary for you for the red flags of tethered oral tissue, the things to look out for that might increase the chances, or might that your child has tethered oral tissue, or side effects of that. Hope this is helpful, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here, and click the golden bell icon and ensure notifications are enabled on your account.